On February 14, 2024, the US FDA approved Aurlumyn with active ingredient Iloprost as the first medication to treat severe frostbite. This medication does provide a new option to help prevent serious outcomes such as amputation for frostbitten fingers and toes. Let's talk a little bit about Aurlumyn and how it works and why it's different from current treatment standards. The information presented in this video should not be used for diagnosing or treating a health problem. Consult your healthcare provider before making any changes to your health plan. So let's first talk a little bit about frostbite. Frostbite is a thermal injury caused when tissue is exposed to freezing temperatures long enough for ice crystals to form in the affected tissue. Frostbite is a serious condition requiring immediate medical attention, and up to now, there were no FDA-approved treatments. Despite advancements in the standard of care for frostbite, amputation of the affected extremity is still common practice in severe cases, which has a major detrimental impact on a person's quality of life. Frostbite affects military personnel operating in cold regions, industrial workers, people experiencing homelessness, as well as people engaging in recreational activities such as skiing, hiking, mountaineering, and ice climbing. Some of the causes of frostbite include when skin and underlying tissue freeze. The most common cause of frostbite is exposure to cold weather conditions, but it can also be caused by direct contact with ice, freezing metals, or very cold liquids. Specific conditions that lead to frostbite include wearing clothing that isn't suitable for the conditions you're in. For example, it doesn't protect against cold, windy, or wet weather, or it's too tight. Staying out in the cold or the wind for too long. Risk increases as air temperature falls below 5 degrees Fahrenheit or minus 15 Celsius, even with low wind speeds. In wind chill of minus 16 Fahrenheit, which is equivalent to minus 27 Celsius, frostbite can occur on exposed skin in less than 30 minutes. So the most appropriate action anyone can take is prevention in this situation, so do dress appropriately. The following factors increase the risk of frostbite. Medical conditions that affect your ability to feel or respond to cold, such as dehydration, excessive sweating, exhaustion, diabetes, and poor blood flow in the limbs. Alcohol or drug use, smoking, fear, panic, or mental illness that impairs your judgment, previous frostbite or cold injury, being an infant or older adult, both of whom may have a harder time producing and retaining body heat, and being at high altitude where there's less oxygen. So frostbite does occur in various stages. Skin without cold damage has no change in color or texture, which is indicated by number 1, no frostbite. Number 2 is frostnip. That's mild frostbite that irritates the skin, causing a change in skin color and a cold feeling followed by numbness. Frostnip doesn't permanently damage the skin and can be treated with first aid measures. Looking at number 3, superficial frostbite, that's when the skin feels warm. A fluid-filled blister may appear 12 to 36 hours after rewarming the skin. With deep frostbite, number 4, you may experience numbness, joints or muscles may stop working, large blisters may form 24 to 48 hours after rewarming. The tissue turns black and hard as it dies. All right, now looking at the complications, frostbite can have severe outcomes. So if you do experience frostbite, you are at an increased risk of increased sensitivity to cold, increased risk of developing frostbite again, long-term numbness, excessive sweating, changes in skin color, changes in or loss of nails, joint stiffness, growth problems in children, especially if frostbite damages a bone's growth plate, infection, tetanus, gangrene, which is the decay or death of tissue resulting from interruption of blood flow to the affected areas, which ultimately can lead to amputation if not managed quick enough, and hypothermia. So remember to seek medical attention for frostbite if you do experience signs and symptoms of superficial or deep frostbite, increased pain, swelling, inflammation, or discharge in the area that was frostbitten, fever, and new and unexplained symptoms. Seek emergency care for hard, cold, blotchy skin. Also get emergency medical help if you suspect hypothermia, a condition in which the body loses heat faster than it can be produced. Signs and symptoms of hypothermia include intense shivering, slurred speech, drowsiness, and loss of coordination. While you wait for emergency medical help or a doctor's appointment, take appropriate self-care measures, such as removing wet clothing, protecting the affected area from further cold, not walking on frostbitten feet, reducing pain with a pain reliever. Mild frostbite or frost nip can be treated at home with first aid care. For all other frostbite, after appropriate first aid and assessment for hypothermia, medical treatment may involve rewarming, medications, wound care, surgery, and various therapies depending on the severity of the injury. Rewarming of the skin. Uh, if the skin hasn't rewarmed already, your doctor will rewarm the area using a warm water bath for 15 to 30 minutes. The skin may turn soft. You may be encouraged to gently move the affected areas as it rewarms. Oral pain medicine, because the rewarming process can be painful, your doctor will likely give you a drug to ease the pain, such as Tylenol. Protecting the injury once the skin thaws, your doctor may loosely wrap the area with sterile sheets, towels, or dressings to protect the skin, or the doctor may protect your fingers or toes as they thaw by gently separating them from each other, and you may need to elevate the affected area to reduce swelling. For removal of damaged tissue or debridement, to heal properly, frostbitten skin needs to be free of damaged, dead, or infected tissue. To better distinguish between healthy and dead tissue, your doctor may wait 1 to 3 months before removing the damaged tissue. Whirlpool therapy or physical therapy. So soaking in a whirlpool bath, also known as hydrotherapy, can aid healing by keeping skin clean and naturally removing the dead tissue. You may also be encouraged to gently move the affected area. You may also consider attending physical therapy sessions. Infection fighting drugs. If the skin or blisters appear infected, your doctor may prescribe antibiotics. Clot busting drugs or antithrombolytics. You may receive IV injection of a drug that helps restore blood flow, such as a tissue plasminogen activator, TPA. Studies of people with severe frostbite showed that TPA lowers the risk of amputation, but these drugs can cause serious bleeding and are typically used only in the most serious situations and within 24 hours of exposure. Wound care. A variety of wound care techniques may be used depending on the extent of injury. Surgery. People who have experienced severe frostbite may in time need surgery or amputation to remove dead or decaying tissue. Lastly, hyperbaric oxygen therapy. This may be used and it involves breathing pure oxygen in a pressurized room. Some patients show improved symptoms after this therapy, but more study is needed in this area. All right, now let's talk about Aurlumyn. So Aurlumyn has the active ingredient Iloprost. It is a vasodilator, meaning that it's a drug that opens the blood vessels in the body and it prevents blood from clotting. Iloprost's efficacy in treating severe frostbite was primarily established in an open label study, controlled trial that randomized 47 adults with severe frostbite who all received aspirin by vein and standard of care into one of 3 treatment groups. One of these groups, Group 1, received Iloprost by intravenous therapy for 6 hours daily up to 8 days. The 2 other groups received other medications that are unapproved for frostbite, given with Iloprost, Group 2, or without Iloprost, Group 3. The primary measure of efficacy was a bone scan obtained 7 days after the initial frostbite that was used to predict the need for amputation of at least one finger or toe. On day 7, the bone scan finding predictive of needing amputation was observed in 0%, 0 out of 16 patients receiving Iloprost alone, group 1, compared to 19%, 3 out of 16 patients in group 2, which was the group that received unapproved therapy along with Iloprost, and 60%, 9 out of 15 patients in group 3, which was the group that received other unapproved therapy and did not receive Iloprost. The presence of the bone scan abnormality was significantly lower in the two groups receiving Iloprost. Most patients had follow-up information on whether they subsequently underwent at least one finger or toe amputation. The need for amputation was consistent with the bone scan findings. As part of the FDA approval process, Aurlumyn did receive a priority review and orphan drug designations for this indication of treating severe frostbite. Iloprost was originally approved in 2004 for the treatment of pulmonary arterial hypertension. For more information on priority review and orphan drug designations, do refer to my other videos that do talk about these specific topics in much more detail. So finally, highlights of the prescribing information for Aurlumyn. Aurlumyn is a prostacyclin mimetic indicated for the treatment of severe frostbite in adults to reduce the risk of digit amputations, meaning fingers or toes. Effectiveness was established in young, healthy adults who suffered frostbite at high altitudes. Aurlumyn is given intravenously as an infusion at 0.5 nanograms per kilogram per minute and titrate in 0.5 nanogram per kilogram per minute increments based on tolerability at intervals of 30 minutes to a maximum of 2 nanograms per kilograms per minute. Administer as a continuous infusion for 6 hours each day, up to a maximum of 8 consecutive days. Patients with moderate or severe hepatic impairment initiate infusion at 0.25 nanograms per kilogram per minute and titrate as described above. Patients with renal impairment, meaning eGFR less than 30 mLs per minute, initiate infusion at 0.5 nanogram per kilogram and titrate as described above. If the patient cannot tolerate the starting dose of 0.5, the dose can be decreased to 0.25 if required. Aurlumyn is available as an injection as a 100 microgram per milliliter in a single dose vial. And again, it is to be used intravenously. There are no contraindications for this product. Aurlumyn may cause symptomatic hypotension because it does dilate the blood vessels. So monitor vital signs while initiating Aurlumyn. Correct hypotension prior to administration of Aurlumyn. Most common adverse events include headache, flushing, palpitations or tachycardia, nausea, vomiting, dizziness, and hypotension. I hope you found this video educational and useful. Please remember to like and share. Thank you.